Good morning, community leaders. I'm Joseph Peretta, an MPH candidate at the University of New England. Today, I want to share an opportunity for Dover to get ahead of a health challenge before it becomes a crisis. Let me start by explaining what makes Dover's situation unique. While Dover is in Morris County, the healthiest county in New Jersey, underneath that success, there are warning signs we need to address. 1 in 5 residents do not have health insurance, and 6 out of 10 families are struggling with housing costs, and nearly 1 in 5 children are living in poverty. That's higher than most comparable communities. These challenges do not affect everyone equally, though. Our African American neighbors face the steepest challenges, earning $12,000 less on average and lower education levels than their white counterparts. Now, you might ask, if Dover is in the healthiest county, why should we be concerned? Because we have a choice other communities didn't have. In other places, these same economic stressors, housing burden, poverty, lack of insurance, created a perfect storm that led to serious health disparities, especially heart disease. The difference is we can see it coming. We can act before this crisis hits, not after. Think about it. It is much easier and less expensive to maintain your car than to rebuild the engine after it breaks down. The same principle applies to community health. So, what's our solution? We looked at what actually works. We studied successful programs and found 2 approaches that work best together. First, we improved communication between doctors and African American patients. When patients feel heard and understood, health outcomes improve dramatically. Second, we provide individual coaching from local nurses, plus home monitoring tools. Research has proven both approaches effective in communities like Dover. Now, here's what makes this different from other health programs. These are not external organizations coming in to quote unquote fix Dover. These are Dover residents leading the work. The nurses running day-to-day operations, they are African American and Black residents who live here in Dover. Recent graduates from County College of Morris and ACE Healthcare Training Institute. They understand the culture, they build trust as neighbors, and they are creating career opportunities while serving their community. We are working with doctors you already know, from St. Clair's Dover, Zufall, and Neighborhood Health. Now that you know who's leading this work, let me give you the specifics of who we're reaching. 250 African American and Black Dover residents will participate over 3 years. Realistically, about 200 will complete the program. People move, life happens. This involves 10 local doctors, 4 Dover nurses, and community leaders like yourselves. This is not a small pilot program. This is significant community investment. Now, some of you might be wondering, who's really in control here? The community is. The community stays in control from start to finish. African American and Black Dover residents form an advisory board that designs their evaluations, reviews all findings, and decides how results get shared. While most health research is done to communities, this research is done with the community. When residents control the process, you get authentic results and lasting change. So, what do participants actually receive? Each participant gets a blood pressure monitor, a pedometer, a digital scale, and educational materials to use at home. Most importantly, they get check-ins with a local nurse every 2 weeks for a personal coaching, goal setting, and progress tracking. They also learn how to be more effective advocates for themselves during doctor visits. Let me show you how this unfolds over time. This is a 3 year journey. Year 1, we set up and start enrollment. Year 2, full operation with all participants. Year 3, measuring results and planning continuation. We are not rushing this. Sustainable change takes time. Now, how will we know if this is working? Our evaluation asks a simple question. How much does each person's heart disease risk decrease? We use a clear method. Health assessment at start, check-in at 6 months post-intervention, final evaluation at 12 months post-intervention. We use proven tools that combine blood pressure, cholesterol, and lifestyle factors. Remember, the advisory board reviews everything before results are shared. We are being honest about limitations. This is not a perfect study design, but it is designed to give Dover actionable information. So, what can Dover expect to see? In the first 6 months, we focus on building strong foundations. We will see early improvements in blood pressure and cholesterol levels as participants start using their home monitoring tools and work with their nurses. Between 6 and 18 months, patients will feel more confident talking with their doctors, and doctors will become better at serving African American patients. Our goal is a 15% reduction in each person's risk of heart attack or stroke. Long term, we expect these improvements to last well beyond the program. Better communication, healthier blood pressure and cholesterol, and closing the gap in heart disease risk for African American Dover residents. Now, let's talk about investment. The total investment is about $300,000 over 3 years, roughly $1,485 per participant. Compare that to treating one heart attack or stroke. This is not a one-time program. The advisory board will be trained to continue leadership, providers keep their new skills, and we have plans for ongoing funding. So here's where you come in. We need your help connecting with African American and Black residents who might benefit. We need support recruiting healthcare providers and identifying community volunteers for the advisory board. So here's our timeline. Over the next 3 months, we will finalize partnerships and form the advisory board. Then we will spend months 4 through 6 training nurses and physicians. Then by month 7, we will begin recruiting the first participants. This is Dover's opportunity to prevent health disparities rather than treat them after they develop. We can be the community that acted early and made a difference. I'd welcome your questions and hope we can count on your support. Supporting research citations are provided here. Thank you for taking the time to hear about this initiative.